Hi, good afternoon. I'm Jeff Thompson, the CEO of Gundersen Lutheran. Today, we had a little time to spend with Congressman Walz. Congressman toured the clinic and got a chance to talk with the staff, talk about the patients that come in, how they move through the clinic, and more importantly, what the clinic does to try and keep them as healthy as possible, and how the clinic connects into other parts of the health system. It is a great honor for us to have Congressman here because he helps us deliver better care to the rural areas through supported telemedicine, through a number of other, the support of electronic records, but in a really big way, supporting the part of healthcare reform that said focus on value, focus on rural areas, focus on the well-being of the patient's health, not just the old fee-for-service system. This was a very courageous move. Most of the rest of the country is interested in just keeping it the way it was, so we moved it forward. It's better for our areas. It's better for Minnesota, Iowa, and Wisconsin to have a focus on value, which we do pretty well. So the Congressman's been pretty busy this last year, and we want to thank him for his effort in supporting rural health care. Congressman.
Thanks, Jeff.
You're welcome.
Well, thank you to Jeff and the entire staff here at the Houston Clinic. My wife made the comment today, just as a side note, she said it's warmer in Houston, Minnesota than Houston, Texas today. So we're feeling it. But to Jeff and the entire organization at Gundersen Lutheran, I think this is a name especially that I saw over this past year. You hear a few names roll off people's tongues when they were talking about what is the model of healthcare this country needs to look like? Quality, affordable care that focuses on preventative measures and uses technology to move us forward. And you would hear Kaiser, you would hear Cleveland Clinic, Mountain West, Gundersen Lutheran, and Mayo Clinic. And that was about the ones that you would hear in that group. Of a model of care focused on value over volume, a model of care that understood accountable care, bringing everyone together to deliver that for the patients. In the long run, not only improved the quality of life and the quality of care of those individuals, it saved money in the long run. It became a more sustainable model. It is especially important, and the reason we're here today, it's especially important because the delivery of health care under the status quo was making it virtually impossible for rural clinics to continue to survive, to continue to move on. So us being here today was to focus on those changes that were going to be made, focusing on value over volume, incentivizing pay on the right things, not de-incentivizing. Again, I think it's an interesting thing. Jeff always gives me things I can use or to think about. Is he said, there's some clinics tend to think that they measure their successes on how full their waiting rooms are. A real measure of success we start getting, it's actually if it's empty, it might be a good thing. It means your people are healthy. You're keeping them out. You've got preventative measures. It's different things of why we're here. And the one thing that I would be absolutely clear on is that it's the innovations that were coming out of this, as Jeff said, and I think it's if everybody in the country could hear this kind of speaking, that we're going to do it anyway. Our organization's going to do these things anyway and move forward no matter what happens. And talking about electronic medical records, it's something I've been very interested in because this is a significant problem in the military, the VA side of things. They have a wonderful electronic medical record in the VA. It's called the VISTA system. The Army, the Air Force, the Marines, the Navy have different ones. And the coordinating of the care and medical records between a soldier who's fighting for this country in Afghanistan, then they're discharged, and then they enter into the VA is not seamless. And it ends up costing valuable time on the care of those soldiers. I have a friend of mine, a sergeant from Tennessee, Travis Fugate, who lost his sight in one eye, and because of the lack of ability to transfer those records, lost the sight in his other eye in service to this nation. That could have been preventable. And what they're doing here is understanding that electronic medical records allow for more timely, efficient, detailed care for those practitioners. It also saves a lot of money. So one of the initiatives in the reform bill on health care was to focus on those electronic medical records. And I would dovetail it one last time to what they're doing here in the rural areas. One of the things in a piece of legislation I have is a fit bill of making sure we use technology to monitor our seniors from home for everything from blood pressure to weight, to, if they're taking their medications on time, to fall monitors in their homes. And it's using technology to maximize these experts and practitioners' time and making sure that our seniors are able to get the care as close to home as possible at the lowest need possible to save money and improve their quality of life. So I'm here today, first of all, to thank these folks, to look into where they're working specifically and sit down in front of that electronic medical record, and to highlight again that folks here in Houston and throughout this tri-state region where Gundersen's reach is so broad is to understand. And when people asked about, and they were right, when people down here in Houston asked things about why do healthcare reform, ours looks really good, they were speaking a real important truth. It does look real good here. In the rest of the country, not quite the same. And if we don't get the necessary reforms to model this, we'll never get there. So thank you. Jeff, thanks for all you do in driving this. The staff here at the Houston Clinic, we're incredibly proud of what you've taught us about the delivery of rural care. So if there's any questions, Jeff will be glad to take them. So that's it. No.
I just have one real quick. At a time when healthcare is such a big issue politically, what does something like this with rural communities mean to southeastern Minnesota?
Well, I think, and what we said is that my take on this is that we dealt with healthcare not because it was going to be a lot of fun or it was something we wanted to do. The numbers were simply staggering. It was an unsustainable system that was spending twice as much as any other country, getting less for it, and our first line of folks who were going to feel the pinch was in rural areas. And so what it meant is clinics like this can continue with reforms, can continue to stay open, can be reimbursed for positive care that they're giving, and make sure that our seniors, our athletes are able to come down here and get their physicals. And if we had not done it, I firmly believe this, clinics like this would not have been able to maintain themselves. So I think the reforms are going to mean you can come down here and get your care. It can be done at an affordable manner, and we think if we follow this model, we can drive down costs across the country, and that's the goal.
One more question, anybody? I'll just ask another one.
Sure.
You mentioned healthcare reform and the FIT bill, but are there any other measures that are going on in Washington right now to kind of continue to
Yeah, it's a great question too. There's other things in here. There was an issue too. One of the things in the pay for on this, I would say, there was an issue for businesses to fill out 1099s on some of their miscellaneous expenses. The House of Representatives voted to repeal that. The Senate still has to work on it. So there are some things, and I think we were just discussing. Former Senator Dave Durenberger had a great quote for me talking about healthcare's a journey, not a destination. It'll always change. I think we're continuing to look at this. The one thing we're monitoring most closely now is very soon the IOM study will be coming out. The Institute of Medicine study will be coming out on how we reimburse based on value over volume. That we're pretty convinced that the experts, the nonpartisan experts, are going to come out with a study that shows the way the Gundersens, the Kaisers, the Mayos do it is the way we should be reimbursing to incentivize quality care. So our job is to usher that thing through, and then, as I was mentioning with Jeff, is to get that information out and disseminate it wherever we can. So thank you all for coming today, and again, one last thank you. Truly one of the most high quality medical delivery systems, not just in this country but in the world, is right here with Gundersen and right here in Houston. And so very proud. And I would leave it with, as I said, a thank you to the mayor, providing great quality health care, providing a beautiful day, and the kids are down at the river swimming. Norman Rockwell would be proud. So thank you. So thanks, everyone. Thanks, Jeff.